Well, good afternoon. I see some familiar faces here. Some of you know me as the old gray-headed diabetes nurse at the hospital, and that's okay if you can't remember Liz. Just remember me, and at least to know who to ask for if you've got questions. We are going to be in the theme of month for heart disease because today's topic is going to be about diabetes and cardiovascular disease. And we're going to kind of go into three areas about that. We're going to talk about the risks and some of the signs and symptoms, and then what the numbers should look like, and some things you can do to improve those numbers. So in order to get a little bit of feel for who's in the room, how many people in the room are on blood pressure medicine? Raise your hand. Okay. How many people in the room are on cholesterol medicine? Okay. How many people in the room are on diabetes medicine? A little bit less, but not unusual. Those three chronic illnesses tend to run together. They are a gang. They are best friends. And it's not unusual if you have one to have the other or all three together. Uniquely, the things that you can do to prevent diabetes and prevent high blood pressure and prevent high cholesterol are the very same things that you do to treat them. And I'm hoping by the time you leave here today that you will at least have a better idea of how to do that when you go. So for those of you that were diagnosed with blood pressure, at the time or before you were diagnosed with blood pressure, did you feel like your blood pressure was high? No. Blood pressure, high blood pressure or hypertension is called the silent disease. Most people don't have a clue they have it till all of a sudden one day their blood pressure is taken and it's elevated and the doctor says, well, here's this pill we're going to give you, right? The same thing kind of goes with cholesterol. Did anybody experience any signs or symptoms of high cholesterol? No, no. Again, one of those diseases that you really cannot target with signs and symptoms. Now, however, diabetes, which I call the sneaky disease, does have signs and symptoms. Most of us that have developed diabetes do so and do so about 5 or 7 years before we're actually diagnosed. And that's why I call it the sneaky disease, because in a lot of ways we can overlook this disease process and many others as just getting older. You know, if you get up in the morning and you can't read the obituaries and you take your glasses off and you clean them and you put them back on and you still can't see them, you think, well, probably need to get my eyes examined. You don't think that your eyes might be blurred because your blood sugar is up. If you're getting up more frequently at night to go to the bathroom, you're not thinking, oh, my blood sugar must be up. You're thinking that prostrate's going to kill me. Or, you know, women after a certain age just have bladder problems. It's just the price we have to pay for having babies. So again, you really don't think that that is an issue with diabetes. And then, of course, you're tired. You're getting tireder. Every day you're getting tireder. Is this not true? And so you think, well, I ought to be. You know, I'm taking care of a 105-year-old mother and 15 grandchildren and trying to hold down a job and volunteer too. Who wouldn't be tired, right? Yeah. Well, you're feeling tired because your blood glucose, which is your energy source, is stuck in your bloodstream. So, of course, you're tired. But you don't think, oh, I'm tired because I have diabetes, right? That doesn't cross your mind. So all of these disease processes are kind of sneaky. And they do kind of go with the process of aging too. So let's talk about a minute for the risk factors for some of these diseases. Now, some things we get in life we have absolutely no control over, and it's in our gene pool. Some things our parents and grandparents just lovingly bestowed on us. I have a mother and 5 of her sisters all suffer from high triglycerides. Doesn't matter what they eat or how they eat, it's still high. And I'm fortunate enough to have inherited that gene, as I also inherited the diabetes gene from my father. So this is some of the things that we look at that are in our gene pool that we can't change. There is a higher risk in some families. There's also a higher risk in certain ethnic groups. For those of you that have some Cherokee blood flowing in your family tree from the hills right here, the Blue Ridge Mountains here at the base of this Blue Ridge Escarpment, some of you may have a higher risk for higher cholesterol and diabetes because of that gene pool. Hispanics have the highest rate, after Native Americans. Hispanics have the second highest rate for diabetes and high blood pressure, followed by African Americans, followed by Asian Americans and Pacific Islanders. So those things we cannot change. The other thing that we cannot change is our sex. Well, I take that back. Some of us can. But postmenopausal women are at a higher risk for the development of cardiovascular disease than most. And if you're an African American woman past the age of 65, your risk is almost doubled. Now that we are researching and getting to see that men need testosterone as they age, then we're also seeing that if men are low in testosterone, it's also impacting their risk for cardiovascular disease. So there's things we learn in this scientific process as time goes by. But then there's the two big things that really have the greatest impact on the development of hypertension, cardiovascular disease, and diabetes. And I call them the two E's. Anybody want to guess what those two E's are? No, already did that one. Postmenopausal. Eating. Exercise. There you go. Those are the two. Studies have shown that when people make a point of exercising on a regular basis, not only do they reduce their blood pressure and their cholesterol and raise certain good cholesterol and lower the bad, but it also decreases their risk for the development of diabetes. Now, why would that be? Let's think about that for a minute. In fact, let's do a little flashback in time. Let's go back to our grandparents. How many people in the room remember their grandparents? Okay. How many of you remember what your grandparents did for a living? Okay. What did your grandfather do for a living?
My one grandfather was
He was a woodmaker, okay. A dental assistant, okay. A politician, okay. We won't go there.
a Chicago politician.
Yeah, okay. Yeah, he's a busy man. He was hopping around a lot. For a large majority of people that live in this area, our grandparents and grandparents came from a very rural background. We're farmers, as was mine. Pardon? A little louder? Okay, I will. For a large percentage of people that live in this area and several generations in this area, our parents and great-grandparents were farmers, or if they were working in mills, they also farmed on the side. So there was a lot of physical work just to survive. I can remember my own grandfather, although he would sit down to a breakfast that my grandmother fixed him, and practically everything on the table that he ate, he raised or produced himself and slaughtered and smoked, or my grandmother churned or made. All of those foods he ate, and then he left the table and then proceeded to be pulled around by a mule all day. And my grandmother, who had 11 grandchildren, or children, excuse me, 11 children, I don't know how many grandchildren, but 11 children. I was 12 years old when she got her first Ringer washing machine. Yes. So prior to that, if she wanted to wash clothes for 11 children, it was let's cut the wood, haul the water, build the fire. So we worked so much harder physically many years ago, and the food that we ate was less processed. So most people didn't die from diabetes or hypertension or high cholesterol. They were too busy working it off. There were other things to die from, more prevalently cancer, or things associated with their work, such if they worked in a coal mine, and black lung disease and things like that, or the good old diseases that we now have cures for, like pneumonia. So people worked so much harder physically back then, and we didn't have the chronic illnesses that we do now, which is why exercise plays such a vital role in the prevention of and the treatment of hypertension, high cholesterol, and diabetes. When we work our hearts, the heart is a muscle, And when we work our hearts, when we get our heart rate up and we keep it there for a sustained period of time, we are strengthening our hearts and we're making our hearts stronger. So that the times that we are in a duress, say for instance, let's just say there were an earthquake right now and the hospital is affected and things are falling down and we're kind of trapped in here. For those of us that are physically in shape, we're going to be able to climb over and through and around and move and even help others get out of the way because our hearts are strong, our bodies are strong. But if we haven't been working our bodies to the potential that we can, we're going to have a very hard time during a time of duress to move our bodies quickly and get to where we need to be. So this is why a lot of people, when they're not in good shape physically, both for their hearts and their bodies, have difficulty and have experienced mini strokes and heart attacks because they aren't in good physical shape when their heart could have been stronger to have done those things. So that's just the background that I'm coming from right now. I want to emphasize of all the things that you do. Research has shown you can even carry extra weight if you are in good physical shape. So if you're doing that, kudos to you for exercising on a regular basis. And this means walking or lifting weights. If some of you are interested, I have some information I can send you to a website. There's even bed exercises you can do. I mean, my goodness, how lazy can you get? All right? So there's always something you can do to move your body, strengthen your body, keep your joints flexible. Now the other E, the eating part. There are some components of what we do. If we would improve the way in which we eat, we could actually lower our blood pressure, lower our cholesterol, and lower our blood glucose levels. So I've given all of you some handouts here to take home with you so that you'll have an understanding of what it is that we're looking toward and what we want to improve. So let's start with cholesterol. Does everybody in the room have an idea of what their lipid levels are? Have you had one done in the past year? Okay, good. That being said, there's some guidelines on this. Although what is mentioned in the paper are good, there's some little bit more specifics we need to look at. We want to see a total cholesterol level of less than 200. If you are being treated for high blood pressure and cholesterol, your physician actually wants that number lower. And if you have diabetes, he or she wants to see your total cholesterol less than 170. Okay? All right? So it used to be maybe 15, 20 years ago, all we looked at was total cholesterol. That's all we worried about. Well, now we know it's the components of cholesterol that really can impact our risk for the development of a stroke or a heart attack. So I want to start with the good stuff first. Let's start with the HDL. Think of HDL, the H standing for happy or healthy and high. You want this number as high as you can get it because HDL transports and gets rid of the bad cholesterol, which is the LDL and triglycerides. So this is the number you want to strive. Now, does anybody know how you get your HDL higher? Exercise. Now, I'll give you an example of this. Back several years ago, I went to see my doctor for my physical, and she had drawn my blood work a week earlier, and that was part of the visit. Come in, talk about the blood work. And I hadn't seen it, didn't know what it was. So she's talking to me, and she says, "Now, Liz, are you exercising on a regular basis?" And I go, "Yeah, Doc, every day." She says, "Well, that's wonderful, but your HDL doesn't indicate it." If you are exercising on a regular basis, your HDL will be greater than 45. If you're really working at it, you're going to be in the 60s and 70s. So don't go into your doctor and do like I did and get busted and tell them, "Oh yeah, I'm exercising." They're going to know. They can look at your HDL and know. We like to see women with an HDL of 55 or greater. This has to do with estrogen and bone health. Men get to have a little bit lower at 45 or greater, but again, the more you exercise, the higher this number will go. And keep in mind, the higher this number is, the more it's going to work on lowering the other ones. So LDL, think of the LD as a low down, lousy. You want this number as low as you can get it, all right? This number is the one that actually likes to lay down in your coronary arteries and make a home and invite all their friends and relatives in for a party and clog it up, all right? LDL, or low-density lipoproteins, are formed basically from the ingestion of saturated fat. Now, who knows what saturated fat is? Yeah, it's animal fat. It's also found in certain exotic oils like palm oil and coconut oil. But saturated fat, animal fat, is probably the biggest detriment to your LDLs. So this is why your doctor wants you to kind of lay off the high-fat meats and go more toward the lean ones. So I had a registered dietitian back several years ago that explained the best way to know how to consume animals. The more legs it has, the worse it is for you. So beef and pork, not as good as the two-legged varmints, which would be chicken and turkey. And of course, fish is the best, no legs at all. Yes, or even deer meat for that matter is not as big a deal, or wild game is not a big a deal. But on the other hand, if it's got a shell on it, not a good idea. And we're talking about your shrimp and things like that that are high in cholesterol. Not saturated fat, but cholesterol. So legs and shells really determine the better choices on your cholesterol levels, especially the saturated fat. The other thing to keep in mind on animal, when we eat a source of animal, is to make it as lean as you can afford and try not to fry it. When you take something and you roll it in cornmeal or flour and then fry it, you've turned it into something entirely different. It's no longer protein. Now it's several different things. So keep that in mind when you eat your protein. So LDL is associated, yes. Oh, I'm sorry, you're just laughing at me, Carol. Okay, with you. Yeah, right. Okay. So saturated fat, we try to avoid that so we can get our LDL down. Now, triglycerides. I call triglycerides the sneaky fat. Most people, when they come to see me, when they're originally diagnosed with diabetes, their blood glucose levels are elevated. Their triglyceride levels are also extremely elevated. That is because when we take in more carbohydrate than our body can handle as a source of energy, then our body has to do something with it. So it takes carbohydrate and stores it as fat, and that fat is triglycerides. So the encouraging thing is when people start watching their carbohydrate intake and maybe decreasing it some, it can help lower their triglycerides. The other issue with high triglyceride levels are those that have a high intake of alcohol. Again, don't try to fool your doctor. Minimal to moderate intake of alcohol has been shown for some people to improve their cholesterol level. However, moderate to heavy use of alcohol will raise your triglycerides. There's no getting around it. So keep that in mind when you're going back to talk to your doctor about your cholesterol levels. So everybody got a little bit better idea on how to work toward improving their cholesterol levels. We want to look at, make sure the protein that we eat is very, very lean, has very, very little animal fat with it. We want to look at raising our HDL by exercise. And you can also raise your HDL and lower your LDL through an increase in fiber. So if you want to look to those high grains, the foods that are high in fiber and whole grains, then that can also help lower your LDL and raise your HDL.
No more French fries.
Yeah, be better not to. Treat it like dessert, a treat, instead of something you do a lot. So blood pressure. Does anybody know where their blood pressure should be? Not where it is, but where it should be. Yeah, 120 over 80 is the typical, considered to be the normal blood pressure. However, there was a big national study that came out about 3 years ago, and it showed that people that are already being treated for hypertension or high blood pressure, if they are on hypertensive medicines and their blood pressure is controlled at 140 over 90 or less, that adding additional medicines doesn't lower their risk of a heart attack or a stroke. So you may be seeing your doctor kind of changing his mind. As long as you're less than 140 over 90, you're on 1 or 2 blood pressure medicines, that may be where he wants you, and that would be okay. However, a recent study just came out last year that does show that for people that are not yet being treated for high blood pressure, the closer to normal, 120 over 80 or less, the more they have diminished their risk for the development of a stroke or a heart attack. So if you're not on blood pressure medicine yet, your doctor is going to try to get you to use diet and exercise to get your blood pressure down. What's the number one thing that can lower your blood pressure? Exercise? That's a good one, but actually there's one that's even better. Weight is the big thing. Weight loss is has the biggest impact on even small amounts. Even 1 to 5% of weight loss can reduce your systolic, or the top number, as much as 10 to 12 points. So a little bit of weight loss can have a lot of impact on your blood pressure. That's something interesting, because you know this aging process is not for wimps, is it? You got to be brave to get old, because everything starts winding down and it doesn't work the way it used to. And even over time for myself, I've seen my blood pressure rise over time. And I'm pretty sure it has to do with that extra 10 pounds I have now that I didn't have 3 years ago. Don't look at my...
How about stress?
Yeah, stress. Yes, stress does that.
Stressful job cause it also?
Oh yes, stress of any kind can do that. There are different forms of physical stress. There is stress from infection. So if you're dealing with a chronic bronchitis, you know, that really terrible thing that's been going around for months and months for a lot of people, the stress of that can have an impact not only on your blood pressure but also your blood glucose. When you're in pain, pain raises your stress levels, your stress hormones, and so that impacts that as well. And then there is mental and emotional duress, and those can also produce greater stress hormones, which in turn is going to impact everything else. Ideally, what I want you to remember when you leave here is that when we have too much glucose on board, I want you to imagine these little glucose molecules flowing through your bloodstream. And of course, the more or higher your blood sugar gets, the more molecules there are flowing through your bloodstream. And every time your heart beats, those little glucose molecules move. And every time they move, they're banging up against the walls of the blood vessels. And after a period of time, that becomes very irritating, and it starts to inflame the blood vessels. So your body tries to compensate for this high blood sugar, and so it produces a hormone to bring it down. What's that hormone? Insulin, yes. So now we've got more circulating insulin working to get your blood sugar down. And so the insulin molecules are banging up against the walls of the blood vessels. And guess what they're doing? Irritating and inflaming. So now we have set the stage for inflammation. Now let's compound that with some stress. Let's have some infection going on, like pneumonia. Or let's have pain from a bad hip or a bad knee that we're constantly dealing with. So now our body's making extra stress hormones. Does any of this sound familiar? Okay, so now we've got these stress hormones, and they're beating and banging up against the walls of the blood vessel, and now you definitely got a sore throat of your cardiovascular system. In essence, that's what you have set the stage for. Your whole body, the linings of all the vessels are now inflamed. Now, guess what cholesterol likes to do? It finds all these inflamed areas and it lays down and it makes a home. And whether it's in your heart or in your legs or going in the carotid arteries up to your brain, you have this fat deposition going down in your blood vessels. And so now the vessels are getting, smaller and smaller. The opening in the vessels are getting smaller and smaller. What should be something this open and blood should flow through very easily, now it's constricted and it can't. So the blood that's on this side of this congestion is trying to get through and it can't. And the heart feels that it can't get through. So the heart increases its pressure. So now we've upped the pressure to try to push this blood through that's pooling back here. And what happens to with the blood when it pools for a while? It clots. So now we have a clot formation. And so the blood still can't get through. The vessels on this side of this occlusion are shouting at the brain in essence, feed us, we need nutrients, get the blood here. And the heart says, okay, I'll do it. And up goes the blood pressure some more. So now a big burst of blood pressure over a period of time, and something's got to give. Either the clot gives and travels and into your heart for a heart attack, or up the carotids into the brain for a stroke, or down into the legs for a thrombosis. Or the vessel itself says, this is it, I cannot take anymore, and it stretches, and this forms an aneurysm. Yes, and if it ruptures and happens to be in a very bad place, like your brain or your heart, then, well, yeah, it's a bad situation. And so much of that could have been prevented. So instead of leaving here on a very sad note, I want you to think about the things that you can be doing today. And start doing today. Spring is just around the corner. If you can't get out and walk because the weather is bad, remember at J.B. Owens Center here in Easley, for $5 for a lifetime you can join. You can go to the gym and walk as much as you like, no matter how hot or cold it is. For those of you that are on silver sneakers with your Humana, you have access to the Y. If you're not using it, I encourage you to do so and take full advantage. Yes, swim and or walk or use the exercises. For those of you that have been diagnosed with diabetes and have not attended diabetes class, your Medicare and your supplement covers diabetes education at 100%. You get 10 hours of diabetes education. So even if it doesn't apply to you, think about your relatives and people that could maybe find a way to live a little bit healthier if they only knew what to do to take care of themselves. And as I said earlier, diabetes and heart disease and blood pressure are so closely related that when you treat one and do something good for it, you're treating the other things too. So please consider everything that I've said today. If you have any questions, I'll be glad to meet with you afterwards. And thank you all for coming.